So the way veins work is that you can think of the vein as like a water hose, but this water hose has valves in it. And that's because there's no pressure to push the fluid. And so what happens is when we move or exercise or flex our muscles, the muscles squeeze the vein and push fluid back up to our heart. And the valves just stop the fluid from going back down. And so in varicose veins, the valves fail open. And so they get large, right? So you can see them under your skin and they can be painful. And there's really no fix for the valves. And so they're often removed, but the problem with that is that if you remove that vessel, then we're kind of relying on other vessels in the area to get the fluid out of your leg. And so a lot of people experience edema, like swelling in the leg after having a vein removed. And veins are removed for various reasons, but the saphenous vein, greater saphenous, is a big vein. It's a major vein. It's sort of a main pathway of fluid out of your leg. And so, some things you might try before having it removed might be, three things. One, elevation, right? So if you lie on your back, lift your leg, and just kind of pump your foot, that will, one, the elevation will kind of help pull the fluid out. Squeezing the muscles will help push it out. So that's one thing. The other thing is to, like, if you're going to be on your feet a lot, you can wear compression socks, which are just like stockings that squeeze your leg and prevent it from getting swollen. The other thing is just, kind of massaging it out with your own hands, sort of milking it from the bottom of your leg to the top of your leg. And so, last option would be the removal of the vein. And I think that just depends on like how much it impacts your life, right? Like how painful is it, and what activities does it keep you from doing, and is it worth dealing with the swelling afterward? So maybe those are some things you want to look into and just know what the risks and benefits are. But for now, I would try conservative management, right? So elevation, exercise, compression socks, see if you can manage it that way.